I was too excited to be done with my talk. I forgot that I have to introduce, not have to, but that I get to introduce my friend and colleague, Dr. Raymund Razonable. And Dr. Razonable, he did his medical school training at the University of Eastern University of Manila. Then he went on and did his residency at Beth Israel Hospital, and he came to Mayo for his infectious disease fellowship, and I've been privileged to be a colleague of his since then. He has really made a name for himself in transplant ID. He's an expert. When I have a CMV question, I know who to call. I call Raymund. He's also an expert in ortho ID infections, and he's going to be giving us an interesting case of a patient after kidney transplant, so right up his wheelhouse. His fun fact is that he runs somewhere in every new place he visits. Thanks, Raymund.
Good morning, and thank you to Abinash and Bobby for inviting me. I was given the task of giving you an interesting case, so hopefully this case will interest many of you, and it falls right within my area on transplantation. So this is, I think, the only transplant-related talk during this time, but she promised me there's going to be a lot more transplants next year. There you go. So this is the story of a 22-year-old woman from Minnesota. She migrated from Ethiopia in 2014. A year after migrating to the United States, she developed end-stage renal disease, secondary to granulomatous nephritis and glomerulosclerosis, requiring eventually a living unrelated donor kidney transplant. It was a paired exchange, which means she had an organ donor, but that donor donated it to somebody else, and that somebody else has an organ donor who donated the kidney to her. And she got induced with a T-cell depleting agent alemtuzumab, that's your Campath, and eventually was maintained on a tacrolimus and mycophenolate mofetil. So this was December of 2017. She was started on valganciclovir prophylaxis for prevention of cytomegalovirus, Bactrim prophylaxis for pneumocystis prevention, and looking back, she actually had a history